Hi, this video is the video of the hair restoration on an African American patient. This patient wanted to lower the hairline. As you can see, the Caucasian, as I mentioned before, has a very high arched hairline. It's above, when you have frown on the top frontalis muscle, it's one finger breadth above and one half on both sides. Now that will be normal for Caucasian, white. However, Asian has a very low hairline along the frontalis muscle. African American has the best of both worlds. African American can have both high hairline, like Caucasian, or low hairline like Asian hairline. This patient opted to have a low hairline. As you mentioned, and I mentioned in the past, if you look at Jamie Foxx or all the famous African American patients, they have very low hairline, and it's all on the border, on the top border of the frontalis muscle. When I have the patient frown, this is where his hairline was. Now, Caucasian, Asian, for men, when we're trying to establish the temple on the side, majority of the time we do tilt it backward a little bit. For women, you tilt it forward. But for African American, the maximum you can go is tilt it straight up. Because a lot of times you cut your hair straight up anyway. But you can't do it tilt forward, otherwise it will look like a woman. So on this patient, I opt to have it tilt straight up. So when he cut his hair, he can have it shaved like this, straight up like that. Before we go further, I want to go to my website, MHTAclinic.com, 866-999-6482. Now getting back to this patient, as I mentioned in many other video, I have many years of restoring hair restoration on African American, black, and mostly curly hair. The uniqueness of African American black hair. There are many uniqueness. Number one, as you know, not only the hair is curly, but the root is curly. So the curly root is very hard to manipulate. It's hard to extract out, and hard to manipulate and hold the hair delicate curly root. In the inexperienced hand, the hand that people don't have a lot of experience in, if they don't have a lot of experience in manipulating African American curly roots, you can actually damage the root and thus lead to further poor hair growth. So through many years of experience and many trial and errors, and having come up with a special instrument and technique, get around that challenge. There's a special technique how you hold the curly root, the special instrument how you hold the curly root, and when you, that's number one, the uniqueness. Number two is when you place the hair curly root in, you cannot jam straight in like a straight hair. You try to like twist it or turn it in a way like a screw-like pattern. So you just like glide it in, and that's the other uniqueness. The third one is when you make the site, you can kind of use a bend needle, so it kind of twists it in. You don't want to go straight. So that's the third uniqueness. The other uniqueness, as I mentioned before, is African American can have a low hairline, can have straight the temple triangle. The other uniqueness is when you talk about zigzag line, the Asian Caucasian have high zigzag line because it's natural. African American like to shave the hair straight anyway, so I like to do a zigzag line very small like this. You don't want too much of a zigzag line, and this allows the patient to shave his or her hairline. So that's why we have a smaller zigzag line, and this is very important about the shaving and all stuff. Okay, and then in terms of like the pinkness after the hair transplant, majority of the time on the light skin, the pinkness will last a couple of days to a couple of weeks max. Majority of the time, but sometimes with thickening on the skin, it will last many months. But on the dark skin, with high pigmentation, the pinkness might occur one day, that's it. And after that, it will disappear because of the dark hypopigmented skin will camouflage it very well. And the curly hair will have better coverage than the straight hair. The thick hair will have better coverage than the straight hair. So this patient will get around 1,500 grafts. Why is 1,500 grafts? This alone will take at least 1,000 already, 1,000 something. And on both sides are 250 grafts and all stuff. And not only by me pulling the hair forward, as you can see, as you push the hair up, he's a lot higher than you can, his thinness. So not only I pull and fill in the empty spot, but I reinforce the surrounding area. Okay, thank you.